Call the meeting to order. This is the meeting of the Cook County Health and Hospital System Finance Committee. Pursuant to the Illinois Open Meetings Act, meetings held remotely will require roll call votes for all action items. To streamline, we've combined the action items into one combined motion. So only one roll call vote will be needed during the meeting unless something else arises. If I could ask the secretary to please call the roll.
Director Deere.
Deere is here.
Director Harrington.
Present.
Director Lunar is absent. Director Story is absent. And Chair Ryder.
Ryder's here.
And for the record, those directors also present. Director Curry.
Present.
Director Guggenheim.
Yeah.
Director Ketting.
Present.
And Board Chair Taylor.
Present.
Thank you. You have a quorum.
Thank you, Debbie. Debbie, is there any public testimony?
We did not receive any today.
All right. Next up is the Finance Committee meeting minutes. The minutes were approved by the board at the March meeting, but are being presented for the committee's review and discussion. Are there any corrections that need to be made to the minutes? Any corrections? Any corrections? Not hearing any corrections that need to be made for the minutes. We're going to hold these for adoption by the committee for our combined motion later today. We are now going to go to, let's see, we've got our report that's being quarterbacked by Charles Jones, but I believe we also have our grant funded contractual requests, and I believe Dr. Joshi or Dr. Rubin are going to actually review the first group of the procurement items that are related to that, but those being items 1 through 13. And just to highlight for folks, request number 15 and 23, which I'm sure Charles will note in his report, are being withdrawn. So are Dr. Joshi or Dr. Rubin here to take us through the first 13?
Indeed, I am. Thanks so much, Director. Given the amount of time here, I hope the directors will allow that I proceed expeditiously. So there's several groupings of contracts, the largest of which pertains to COVID. This one happens to be tangentially related. It's for, I believe, an extension and an amendment to a contract with NAMI Chicago. We are working with NAMI Chicago to expand their behavioral health hotline from the city of Chicago to cover suburban Cook County as well. This amendment will allow for additional staffing to support that expansion, particularly given there are concerns around the increased call volume therein. And NAMI is a sub-grantee on our CDC Health Equity Grant. Next one. Great. This is also a sub-grantee on that same grant and is essentially to meet emergency food needs and food insecurity in vulnerable populations across suburban Cook County. And CIFPAC, this entity, will work with key partners across suburban Cook with a focus on supporting Black, Indigenous, Latinx, and people of color. And will provide 5 micro grants to local businesses to support that emergency food distribution that I mentioned. Next one. Okay, so this is now a first in a series of contracts with community-based organizations throughout suburban Cook County that are supporting our hyperlocal vaccination program. All of these entities are doing several activities. First, they're supporting with outreach and education around vaccination. Second, they're working to ensure that individuals who may have various barriers to access, like transportation, that those barriers are overcome. And then thirdly, they work with us and some vaccine administration providers for whom you'll see contracts shortly to hold hyperlocal vaccination clinics throughout suburban Cook County. So in the aggregate at this point, we've held, I want to say, nearly 40,000. We've administered more than 45,000 doses of vaccine with over 400 individual vaccination events across suburban Cook County, again, with a focus on our most vulnerable populations. So Debbie, I'm not sure how you want to proceed because the following, I think several contracts are very, very similar in nature and all with just different.
Dr. Yoshi,
Yes, ma'am.
I have a question, which is, what sort of methodology do you use for identifying which are the most vulnerable communities? And I'm asking this merely from interest because it seems like such a conundrum to figure this out.
Yeah, so a couple of methods. One, and it's changed over time depending on how the pandemic has gone. So I'd say one of the ways that we do it is by looking at the COVID-19 Community Vulnerability Index. This is an index which is a roll-up of a number of indicators that's been used across the country to look at communities, and we do this at the municipal level, that are most vulnerable. Two, we look most simply at communities with the lowest level of vaccine uptake. Again, here, I could talk about this for a long time because I find it really exciting, so forgive me if I'm providing too much detail. And then I would just say, thirdly, you can't just look at it by units of government or political boundaries, because there could be, for example, a factory with vulnerable workers in Northbrook, right? And we would want to ensure that those workers also get access to vaccine. And that's by us outreaching through, for example, worker centers and receiving inbound requests from various stakeholders. So there's not one method. The methods have changed over time. But given our commitment to equity, we sort of have an ongoing internal conversation to ensure that we're refining the way that we're doing this.
Thank you very much.
Yep.
Okay.
Thank you.
Karen,
Debbie, yeah, great. So,
don't
go ahead.
Don't be afraid to put your foot on the gas.
I see a hand raised, Director Ryder.
This is Director Harrington. I'm assuming and sure that you have metrics to each of these organizations, and they've met the metrics in the past, and that's why they're being funded moving forward.
Yes, absolutely, that's correct. We do look at these metrics very closely. They report on a weekly basis on a number of metrics. That's correct. Okay. So next up is Clark, and this is an entity that, with whom we have RFP'd previously, that we're exercising a contractual clause for an extend and amend. Again, this is an entity that provides mosquito abatement services such as spraying larvicide and that kind of thing, and as a part of our West Isle control program, our vector control program. Next up. Great. So now we have several vendors who I'd referenced earlier. These are the result of an RFQ, and we identified several vendors to assist us with in-home vaccination, of which Simpar is one. This has been a very successful program. Again, thousands and thousands of doses of vaccinations administered in people's homes to our most vulnerable residents. So we have this one, which is for in-home, and then we have a few that will follow for those that basically staff and hold vaccination events in the community through our hyperlocal program. And so, yeah, that's correct. So Simpar, I believe, is doing both. They're doing in-home for us, and then they're also doing community sort of hyperlocal vaccination. Prism, very similar. And I think that's it for me.
All right, thanks. Thanks, Joshi.
Thanks.
Charles, you're up, and if I could, Lyndon, if you could take the gavel, I'm gonna step away for a little bit. All right.
All right.
Thank
Great,
you.
thanks. Good morning, everyone. Charles Jones, Chief Procurement Officer, Cook County Health. So as stated by Chair Ryder, we have withdrawal for number 15 and withdrawal for number 23. So with that, we have 32 contracts and procurement items for review. Of those 32, 5 items are of no fiscal impact, so they do not require responsive letters from the Office of Contract Compliance, leaving 27. And of those 27, we have 18 responsive letters back, so therefore 9 is outstanding. Okay, so moving to the request 14. And as mentioned, with these next several requests with zero fiscal impact, just for point of reference, the procurement policy states that contracts that can be extended underneath the CPO and CEO's authority for a 12-month period without board approval, if no additional impact of funding after such time the board has approved. So that's why these next ones are coming before you today. 14 is to extend the contract with Avid Diabetes Sales Corporation for blood glucose meters and test strips, and also continuous glucose monitoring. We're exercising the second and final renewal option for 12 months, a 12-month period. Request 16. Extend the contract with Smith Group JJR for architectural engineering and construction administration services for CCH construction project. 12-month extension here as well. This project is CIP funded with the Department of Capital Planning and Policy. Vendor will provide architectural service, construction administration, and design for Providence Hospital, ambulance bays, and other construction projects as defined. 17, extend the contract with Telecheck Technologies for software support, maintenance, and enhancements. Zero fiscal impact, 11-month extension here to provide continued provisions of maintenance and support for bed tracking, pyramid tracking, and transport tracking software applications. 18, amend and extend the contract with Halliburton Root LLC for architectural designs for the clinics, zero fiscal impact, 6-month extension here. Continuous of architectural and engineering services that will allow the vendor sufficient time to finalize the existing projects for the health centers. 19 is to amend and increase the contract with Cerner Corporation for software support, maintenance, enhancements, and hardware. There's 2 different scopes of work here that we are amending. The first one is $1.14 million, and the second one is $272,000. Combined physical impact for FY22 for both is $319,000. First one will require services and solution to adhere to the CMS mandate No Surprise Act. The act protects patients covered under group and individual health plans from receiving surprise medical bills when they receive most emergency service, non-emergency service from out-of-network providers and in-network facilities, and as well as services from out-of-network ambulance service providers, $1.14 million. And then we have specialty consults for prerequisites for the reopening of the Provident ICU and restarting the ambulance runs. We have Amwell telehealth carts and peripheral that's required at Provident, and for remote specialty consults for storage attendants as well, $272,000. Again, total increase amount $1.4 million. Verse 20. Amend and extend the contract with GHX, which is Global Healthcare Exchange, $65,000 FY22 physical impact, $312,000 total. This is exercising the first of 2 renewal options for the contract for a 24-month period. This is subscription service for supply chain management with all our electronic requisitioning with P-Suite, EDI, submittal of submittal of purchase orders and acknowledgments of POs back to EDI, as well as VendorMate, which is utilized for vendor rep credentialing, and then human resource uses it for onboarding of agency staff. '21, extend and increase the contract with ABM Healthcare Inc., shuttle bus services throughout Stroger and Central Campus, $815,000 fiscal impact for '22, $2.7 million for the 24-month extension period, and exercising the final renewal option there. '22, we're extending and increasing the contract with Johnson Controls Inc. for testing, maintenance, and repair of the billing automation system, the security and the radio transmissions in the emergency department, an 11-month extension here for $1.42 million. And this will allow the vendor to continue providing testing, maintenance, and repair services for the security system, billing automation systems, and the 2-way radio systems and electrical distributions at CCH. '23's withdrawn. Yes, Director Story.
Excuse me. Can I ask you a question? I know Commissioner Deere was on. He would ask you about the minority vendor participation in that Johnson contract. Can you comment on that?
Yes, they're compliant. They're fully compliant and responsive to the minority participation. Is there something else? Okay. All right. Okay, 24. Extend and increase the contract with Lindy Inc. Certification, maintenance, and repair of our med gas system within Stroger and Provident, $271,000 FY22 impact, $407,000 for the 12-month extension. 25 is extending and increasing the contract with Vision Inc. for consulting resources and RFP development, $286,000 for FY22 impact. 6-month extension. This will continue provisions of receiving process improvement, implementation services, as well as professional consultant services within materials management as they continue to work through the completion of the RFP process for inventory management and small parcel packaging tracking systems we're putting in place. 26, extend and increase the contract with Lincoln Park Dialysis Services, doing business as the Vita. This is human hemodialysis at Cermak, $126,000 for FY22, $252,000 with the 12-month extension, exercising the first of 2 one-year renewal options here. 27, extend and increase the contract with Illinois Department of Public Health for newborn metabolic screening, 12-month extension, $87,000 FY22 impact, $175,000 over the next 12 months. We are mandated by the state to do metabolic screening on newborns. We send a test to the state, also mandated to send a test to the state for results, and we're charged by the state for it. So this is a state regulation. 28. Execute a contract with GE Precision Healthcare. This is the FY22 capital contract for anesthesiology equipment, $1.8 million. We're buying 10 anesthesia machines for Stroger, and this will be funded through our lease line of credit. Similar with number 29, executing a contract for FY22 capital with Strecker Sales LLC, hypothermia kits, $533,000, 22 units total, 20 within Stroger, 2 within Provident for various ICUs and NICUs throughout Stroger and Provident. 30 is a new contract with Rush University Medical Center for perfusionist service, $266,000 FY22, $400,000 for the 12-month period. This is provide routine on-call perfusionist coverage, required 24/7 and for off hours and weekends, nights, in emergency cases. Perfusionist services are essential to performing open heart surgery and providing short-term oxygenation to patients when the heart and lungs mechanisms fail. 31 is another capital purchase with GE Healthcare, new contract here with the Stroger 6th floor telemetry expansion equipment and also network design, $348,000. The vendor will provide and develop the network design as well as providing the purchase of the equipment and installation. 6-month contract to allow for the process. 32, here you probably, it's a little different that you've seen for the first time. We have 2 contracts listed with West Care, Illinois. Both contracts are under the $150,000, but the net aggregate total of 287 takes us over the 150 threshold. So therefore, they are coming to you for approval. 90,000 physical impact FY22, 287 total. 2 different grants, 2 different scopes of work. Contract 0017 for $138,000 is 11 months. Contract 0047 for $149,000 is 21 months. This is to participate in the Learning and Action Network and also conduct assessments of behavior cognizant therapy. First contract scope of work, again, participate in the Learning and Action Network meetings, coordinate recovery for home transition, housing referrals, and partnering with CCH and all end partners to explore a harm reduction oriented low barrier recovery pallet home. And then the 21-month contract for $138,000 will allow the vendor to conduct assessments and behavior cognizant therapy to at-risk probation defenders who are at high risk of reoffending. Both contracts will be executed separately, but one approval. 33, another FY22 capital purchase, but this one is grant funded by the Illinois Department of Commerce and Economical Opportunity Grant, the DCEO, Olympus America. We're buying laser systems, urethroscopes, and STERRAD, sterilization test equipment and accessories, $162,000, all for Providence Hospital. And lastly, number 34 is to execute a contract with Enliven Health and Omnicell Innovation Company for medication synchronization, $31,000 FY22 impact, $160,000 for a 36-month period. Vendor will provide adherence and patient management solutions to pharmacies and healthcare providers across CCH. The medication synchronization solutions offer multiple benefits for patients, the providers, and for pharmacies. Coordination of patient medication refills, improving medication adherence, optimizing the pharmacy patient's intervention, and improving patients' health outcome. Any questions? Okay, hearing none, we'll go to the MWBE metrics for the month of February. Looking at the second column from the right, from February, that's 28 contracts that came to you for approval. 7 of those contracts had contract-specific goals for $87 million. Therefore, 21 were 0 goals, meaning that there was no one certified in Cook County and or the city of Chicago where we have a reciprocal relationship. Unfortunately, no primes were awarded for the month of February. However, 5 subcontractors was done for $24.5 million and approximately 28% participation. Unfortunately, again, we had 2 waivers, and I say unfortunately because I consider waivers a bad thing. One of those were for a contract for the health plan service that provided kidney care program, and the other ones also for the health plan service, a contract for actuary services. So two waivers here. Looking to the right, far right column, this is your year to date for the first quarter of FY22, December, January, and February. 23 contracts with goals for $149 million. 2 of those were primes for $4.9 million, 17 subcontractors for $39.7 million. So 19 contracts there for approximately $44.7, almost $45 million of participation. And there are 4 waivers for the particular quarter. Next page will give you a visual with the bar chart. 28% for February, right now trending for the quarter, hovering right around 30%. Any questions? And lastly, we had 2 emergency purchases, one for in the month of April with Deloitte Consultant LLP, a 6-month contract to provide management, operation model, redesign, optimization, and backlog support for my department, supply chain management, $1.16 million. And on March 21st, we also provided notice of another contract with Deloitte for 6 months as well for human resource recruitment, lifecycle redesign, and optimization, $4.76 million there. Any questions? All right, here none. Thank you for your time today.
Thank you, Charles.
Morning, Directors. Pam Casera, Chief Financial Officer, Cook County Health. We'll start with the receive and file grant awards and renewals. We have 3 today, $7.5 million, all from the Illinois Department of Public Health. These were all approved at the county, last county board meeting. And I believe Dr. Joshi is still on if there are any questions related to the COVID-19 ones. Hearing none, we can move on to the receive and file transfers. We also, as we have in past months, need to transfer $10 million from salaries and wages to cover the registry that we've had in the agency, nursing agency for the Omicron surge. Any questions on that? All right, moving on to the financials. Starting with the executive summary, CCH ended the first quarter on a positive note. We came in at 16.5 million positive variance to budget. And on a cash basis, the county has us at 157 million. A couple of key items on the revenue side: lower than budgeted net patient service revenue due to lower outpatient volumes, and county care per member per month rates had not yet been adjusted. So their revenues are below budget while their membership is above. On the expense side of things, we had a negative variance to budget purchase service expense from high agency costs, partially offset by salaries and wages being under budget due to positions not yet hired. And we had lower than budgeted county care claims expense, helping create a positive variance as well. County care is showing an operating gain of 15.5 million, and their membership is over 426,000. Next slide, Debbie. So here are those financials that I spoke to, the main variances. Again, total revenue under budget, but total expenses also under budget, which helped drive the positive variance. Net income coming in at 22.1 million, the budget 5.6 or $16.5 million positive variance. Next slide, Debbie. Moving on to our volumes, as you've heard us talk about in prior months, December, January were Omicron. February, things tapered back down. So for the first quarter, we have a mixture here of sort of the inpatient being at budget, but the outpatient being behind budget. And again, the ER behind primarily because we budgeted for the Provident ER runs to have started, but they have not. But even without the Provident ER, we're still better than 2021 to the tune of about 2,000 visits or about 22 more a day. So it is starting to come up. And then surgery and clinic behind budget and basically flat to last year. Next slide, Debbie. As you look at these key volumes over the last several years, you can see the trend is a very slight trend up. If you take out that budget column, maybe not as optimistic as we had hoped in the budget, but our 2020 to 2021 to 2022 actual projected is trending up in pretty much all areas. Next slide, Debbie. Here we have our charitable and public program expenditures here as well. We are projecting to come in a little bit higher than budget at this point. Of course, it is just through the first quarter. So as the rest of the year, we may bring that back in line with budget. Next slide. The payer mix, both in terms of charges and encounters. Again, the main difference in these graphs is driven by the high volume and low dollar clinic visits, which drives that uncompensated bucket 6% higher when you look at it in terms of encounters. Next slide, Debbie. Here we have our revenue cycle KPI, all outlined in green and meeting goal year to date. Next slide. And then our denials continues to run in the yellow. However, the post-improvement trending fewer dollars being written off. So we're making improvement there as well. Next slide. And then our savings initiatives, 25.5 million budgeted, we're on track at 3/12 or 25% and 6.5 million year to date. Next slide. And then county care, as mentioned, 15.4 million, the budget 6.6, so they're 8.7 over their budget. And as you have probably heard, the public health emergency was extended through July. So although you look at the bottom graph there, budget, we budgeted for redetermination to start at the beginning of the year and for membership to decline slowly over the course of the year. With that public health emergency extended, we will actually not start to see that hopefully decline until late this year, like around October.
Question.
Sure.
You said earlier that the county care rates had not been adjusted. On what basis will they be adjusted? And I'm presuming the thought is that will be increase of rates, but just
Correct.
say a little more about that.
Yes, the per member per month rate, and I believe Aaron might be on, he can chime in, but the per member per month rate had not been adjusted since the state fiscal year. That was adjusted, and that cash, I believe, did come through in March. Aaron, anything you want to add?
Yeah, so thanks for the question, Director Ketting. So there's two different rate adjustments. So one is for fiscal year 2021, we just received the cash for that, or part of the cash for that in March. And so for context, there was about 90 to 100 million of rate adjustments in 21 that we were waiting on a cash basis. For 2020,
are those primarily due to difference in patient treatment, severity?
Yeah, so there's two things that happen. One is the state updates their rates on an annual basis, and then there's a risk adjustment process for the acuity of the members. The state flushes those adjustments through, both of those adjustments all at the same time. So there's a pretty big lag on when those come through. For 2022, we have included here our estimates of the 2022 rates for that annual rate setting process, which is why this gap is narrowed. I think last month it was something like a 25 million gap on revenue, and now that's down to 3. This does not yet include any risk adjustment impacts, which we won't know for sure from the state for probably another 6 to 8 months or so. So there's some components that are built in and some that we'll still be waiting on.
Great, thanks.
Thanks, Aaron. Any other questions on county care? All right, next slide, Debbie. And then more care membership and performance continues to run below target. $1.9 million loss, budgeted to be a $2 million loss, so just slightly better than budgeted. And then last slide, the medical loss ratio, which we include quarterly, is the measure of the percentage of premium that the health plan spends on the claims, and it came in at 91.1% first quarter, which looks like it's the lowest since the second quarter of 2020. So doing well there. Any other questions?
Hearing none. Directors, do you have any questions? Want to throw in the chance? Thank you. Hearing none, I would like to entertain a combined motion to accept item 3A, 3/18, March 18th, 2022, the Finance Committee meeting minutes. Approve item 4A, contracts and procurement items containing request numbers 1 through 34, with the exception of with the exception of request number 15, which was withdrawn and subject to completion by review of the contract compliance. Review and file item 5A, the CCH grant award related items, and receive and file items 5B, the proposed transfer of funds. Secretary, please call the roll.
Just double checking, it was moved by Director.
I'm sorry, do we have a motion? I'm sorry, do we have a motion?
Sorry.
So move.
Do we have a second? Is everyone, Director Harrington, you moved, do we have a second?
Chair Taylor, you can second it yourself.
Okay, then I second it. Okay. Will the Secretary please call the roll?
Roll call on the motion to go in, on the combined motion. I apologize. Director Deere, aye or nay? Director Deere is absent. Director Harrington?
Aye.
Director Munar is absent. Director Story?
He's muted.
Director Story? So to interrupt the roll call, which I don't believe I'm supposed to do, we need 3 affirmative votes, and we do need 1 more member to vote if Director Story stepped away. I don't know if Chair Taylor can have one of the other directors fill in as a substitute in the middle of a roll call. Jeff, do you mind opining?
That would be appropriate if since I'm looking right now at Director Ketting on my screen, if he would volunteer to serve as a member of the committee temporarily, that would work.
I'd be delighted to accept this great honor and cast my vote in the
Yeah,
affirmative.
I just talked to Director Story. He's having some trouble, connection issues. And
Okay,
he is in favor, but he has connection issues in terms of audio.
So to recap, we had Director Harrington voting aye, and Director Ketting, who's serving as a substitute member, aye or nay?
Aye.
Director Munar is absent. Director Story is here, but he is not connected, so he is currently absent. And Board Chair Taylor.
Aye.
And Chair Ryder is absent. So you have 3 ayes, 0 nays, and 4 absent.
So
Debbie?
I think,
I said aye.
Oh,
okay, there you go.
Director Story. Thank you.
So,
Sorry about that, Chairman.
no worries, Debbie. So I think we have in Director Ketting, you can substitute. Can you review the vote?
So then the roll call vote would be Director Harrington voted aye, Director Story voted aye, Board Chair Taylor voted aye, and we had Director Deere, Munar, and Chair Ryder absent.
Okay,
Is that correct? Yes.
that is correct. Thank you. I think the given that the ayes have it, motion passes. I think that is concludes our business for the day. Given that, we'll adjourn until the next regularly scheduled meeting of the committee on Thursday, May 19th at 9 a.m. Thank you all.
Thank you.